Good afternoon, and welcome to Chronic Chaotic, where we talk all things chronic and all things chaos. My name is Jess. If you don't know me, welcome. I'm just your average neighborhood dumpster fire. Quick recap, I'm 37 years old. I live on the East Coast of the United States of America, in Delaware specifically. And I am chronically ill and chronically unchill. So that's what we like to talk about here. Nothing is off limits, really. Well, within reason. So yeah, let's get to it. Today I would like to talk about medical things. Ew, I'm sorry. I always do that. Today I would like to talk about medical testing specifically. I think I want to do rating medical tests based on how much they suck as a chronically ill person. I think this is an interesting topic. So that's what I'm going to talk about today. Now, obviously, my chronic illness is different than anyone else's. No chronic illness is the same. Everybody is different. Everybody has different symptoms. Everybody has different things that help them. I just want everybody to take a moment to remember this. And just because one thing works for you, it doesn't mean it will work for anyone else. Just because one test feels horrible to you doesn't mean everyone else is going to feel the same way. So this is specifically from my point of view. So this is like what I think of these tests. Some of these you might be like, oh, that's easy peasy lemon squeezy. Others you might be like, that's difficult lemon difficult. Okay. Just so we're on the same page. The reason I wanted to go over this today was because yesterday I had one of the more annoying tests, which I will get to. I'm just going to name off different testing, and we are going to talk about pros and cons, and then I'm going to give you like a number rating between 1 and 10. 1 is good, 10 is bad. We'll do it like the pain scale. For those of you who know, if you know, you know, the pain scale is a thing. When you go to the doctor, they'll ask you, what is your pain scale? From a 1 to a 10. 1 being no pain at all. 10 being the worst pain imaginable. So that's what we're going to do. First up, routine blood work. I have had more blood work than I even know what to do with in my lifetime. I have had CBCs. I've had metabolic panels. I've had my C-reactive protein checked. I've had sediment rate checked. I've had all sorts of blood work. I've had vitamin levels. I've had levels of different biologic medications checked. I'm going to give routine blood work a 2 out of 10. Easy peasy for me. I do not mind getting blood taken. I do in a way. I'll get to that. The reason for the 2 out of 10 is because of all of the other testing I've had, routine blood work is the easiest, in my opinion. Some of the easiest. The initial needle stick. Oh, I probably should throw a trigger warning in here. We're going to be talking about medical stuff. So if that is bad for you, you might not want to continue with this video. You might not want to watch. I will be talking about medical equipment. I will be talking about bodily fluids. So if that is not something you're comfortable with, you might want to back out now. Routine blood work. 2 out of 10. That's what I'm getting at. A 2 out of 10. Only because the initial needle stick, yeah, it's but it's not so bad. It's not so bad. And it's quick. Usually blood work doesn't take long. And I mean, I've had 16 tubes of blood taken at one time before, and it wasn't that bad. I also have something called vasovagal syncope where I will pass out sometimes due to stressful situations, or I have other triggers for it, and watching my blood get taken can make me pass out. I'm talking flat out blacking out right there. So what I do is I just don't watch them do it. It's not even the needle going into my arm that does it. It's literally watching the tube fill up with my blood. I can't do it. I just can't. It skeezes me out. Ugh. Still, blood work, routine blood work. I'm giving it a 2 out of 10. And it's based off of like pain, annoying, like the annoyance level. This rating is if it's like painful, annoying, or uncomfortable, or it's just bad, negative. Stool tests. I'm gonna be a baby. I'm giving that like a 5 out of 10. I hate doing the stool tests. Specifically, the one that I always have to do is calprotectin. A calprotectin test measures the inflammation in your gut. I have Crohn's disease, by the way. I know I didn't say that in the beginning, but that is my chronic illness. We are testing for other ones, piggybacking off the Crohn's as well right now. But I have been diagnosed officially with fibrostenotic Crohn's disease, and stool tests are just part of it. I have to give them every now and then when I'm having problems or pain. They want to check and see what the calprotectin level is, which measures inflammation in your gut. I'm rating it a 5 out of 10 because it is just really awful. It's really gross. It's a gross test. I mean, think about it. You gotta poop in a hat, essentially. They give you this like little plastic hat looking thing that you gotta stick under the lid of your toilet, and you do your business into it, and then you gotta scoop it into a little container, send it off to the lab. It's very gross. Okay, if you're a little squeamish with like bodily functions and fluids, that test is going to be hard for you. It's hard for me. And like, I have changed many a baby diaper in my life, but it's not the same. It's uncomfortable and it's gross, and I don't like it, so it's getting a 5 out of a 10. Next test. Let's say x-rays. Body x-rays. Back, hand x-rays, shoulder, wherever. Different x-rays are a little different depending on what you're getting done. Some are more uncomfortable than others. I had a back x-ray done the other day, so I will just use that as my baseline. I'm going to give that one a 3 out of 10. Only because when you're getting an x-ray of your lumbar spine, like your back, your sacroiliac joints, which are like down near your tailbone, you just have to lay on a flat table, and that if you're in any pain at all, it's just uncomfortable. It's not necessarily painful, but you do feel a little stiff when you try to get up. So that one's just more uncomfortable than anything. So that's why I'm rating it a 3 out of 10. Ultrasounds. I'll do 2 different types of ultrasounds. Okay, so like abdominal ultrasounds. Let's do that. I'm going to give that one a 4 out of 10. I've had my gallbladder ultrasound done a few times, and every time it's just uncomfortable. Not necessarily painful. There are a couple points where it could be considered painful because they really dig in there with the little wand. I was in more pain with my body from laying in the position that they had me in. So it's just uncomfortable. So that's why it gets a 4 out of 10. Now, transvaginal ultrasound, that gets, I'm going to say like a 5 or a 6 out of 10 because that gets a little more uncomfortable. Obviously, think about it. They take a wand that looks kind of sus, okay? They slip a little down on it, lube her up, and then it's a disappearing act. And they wiggle that thing around in there to get every little angle they can get. Try to get open. I know I'm making it look much more barbaric than it actually is. but it's pretty uncomfortable. Sometimes can be a little painful, especially because sometimes you have to drink a certain amount of liquid water beforehand, and then you have to hold your pee while they get up in there. So that adds a level of more being uncomfortable. So that one gets like a 5 or a 6 out of 10 for me because it's just uncomfortable. I'm going to get into what I had done yesterday now. So yesterday's test is called a CT enterography. That test measures, well, I don't want to say it measures. It looks at your insides, like your guts, intestines. They do CT enterographies and MRI enterographies. I've had them both. CT enterography, I'm giving it a 6 out of 10. MRI enterography, I'm giving it an 8 out of 10. I really, really, really fucking hate the MRI enterography, and I'll tell you why. But first, CT enterography, you go in, you have to drink 32 ounces of contrast, which is literally 2 big 16-ish ounce bottles of what I can best describe as flat Mountain Dew from hell itself. That's what it tastes like to me. You gotta chug a lug it in like 45 minutes, both of the bottles. And I am not a fast drinker, so I have a problem with this every time. But I just drink as much as I can, and that usually is fine. So I did that yesterday. And then the CT is a little different than the MRI. With the CT, they give you IV. I'm trying to show you my little IV wound. They give you IV contrast as well. Now, when I have the CT enterography done, I usually, the past couple times I've gotten regular CTs, I've gotten really nauseous in the machine. The first time it happened to me, I thought I was going to absolutely puke all over their expensive machine. So I told her yesterday, I was like, listen, I have been getting nauseous in CTs, like regular CTs. So since I just drank all of that liquid, you might want to give me like a bag in case I need to yak. And she was like, thank you for letting me know. She's like, I've literally watched people projectile in these things. So thank you. And I was like, all right, cool. Luckily, I did not puke yesterday. However, I did bleed everywhere when she pulled my IV out. So anyway, CT, what did I say? I was giving that one a 6 out of 10. It's just like, there's a lot of elements to it. Mildly uncomfortable, makes you nauseous, and just not fun in general. The MRI, though, gets an 8 out of 10, and I will tell you why. Because not only do you have to drink all of the bottles, I think it's 3 bottles for the MRI. You got to drink 3 bottles of the contrast, which is just horrendous. Not only do you have to try to keep all that down, but they put you in the MRI machine on your stomach. You have to lay flat on your stomach after drinking all of that disgusting shit. And then you're in the tube for like 40 minutes. And you have to keep holding your breath on and off. And I swear, I have never needed more willpower not to vomit than when I had to have the MRI enterography. Thank you, Jesus, that I did not have to have that done yesterday, because I would have been very sad. Anywho, that gets an 8 out of 10 because it's very difficult for me. I do not like it. It is uncomfortable. It can be painful. I don't like feeling nauseous. I don't like feeling like I'm going to puke in a very expensive machine. 8 out of 10, do not recommend. Tilt table test. This one I haven't had in years and years and years. I was 17 when I had this. I remember because it was just a few months before my 18th birthday. But because of that, I had to be on the kids' floor when I did my testing. And I was very sad. I was in the hospital for like 4 days. I was admitted. They were testing me for, well, what I now know was the vasovagal syncope. They weren't sure if I had that or a seizure disorder or whatever. So they kept me for 4 days. They had electrodes glued to my head. They told me that if I didn't pass out in that 4 days' time, then they were going to do a tilt table test, which is where they strap you to a table, okay? They lift up the table so that it's almost like you're standing, but you're not allowed to put any weight on your legs. So you have to dangle there, essentially. They're trying to get the blood to rush from your head so you pass out. They want to make you pass out to see what happens while you're passed out so that they can try to like figure out what's wrong. And if you don't pass out in that 45 minutes during the tilt table test, they make you pass out with medication. They give you like adrenaline and you go night-nights real fast. So, of course, I had to have this fucking tilt table test. And I didn't pass out in the 45 minutes. So they had to inject me with the adrenaline. And I just remember opening my eyes and they were like, aha, you passed out finally after the adrenaline. I'm like, okay. And I guess that's how they figured it out that I had the vasovagal. But that test was not fun. I'm going to say probably like a 7 out of 10, only because I don't like being I didn't like being forced to pass out. It wasn't as bad as some of the other tests I've had, but like I don't like the feeling of passing out. It's scary and it was just uncomfortable. That's all. It wasn't painful. Whatever. Now my least favorite test of them all. Colonoscopy. And everybody here is going to think I'm a baby back bitch because colonoscopies are really not that bad, but I got to have them every 2 years for the rest of my life. So they're just freaking annoying, okay? And they are invasive. I don't care what anyone says. I know you get knocked out for them, and I know that like you don't feel anything or hear anything or see anything while you're getting it done. However, you are present for every single second of the night before. And when I tell you colonoscopy prep is worse than the actual colonoscopy itself, I mean it. Because at least you're not there for the colonoscopy, you know? Like the prep, you literally like shit your entire life force out. Sometimes the prep makes you puke. I've been there. It's not fun. You have to drink an obscene amount of liquid or it might not work. Like they literally can turn you away if you don't have a clean enough prep. It hurts. Your butthole by the end of it is on fire. Listen, we keep it real here. I apologize, but these are things that people who are chronically ill have to deal with, okay? Colonoscopy. I'm going to give it a 9 or a 10 out of 10. I hate it. I hate it so much. It's the worst one for me. I would rather do whatever else than a colonoscopy. That's my little list of ranking medical tests based on how annoying and uncomfortable and painful they are. If you agree with my answers, or if you disagree, feel free to leave me comments and tell me what you think. Give me your numbers. I'm interested to see what everyone thinks. I just wanted to come on here because I thought it would be fun to see everyone's answers and for you guys to hear mine. So please tell me what your least favorite versus least bad tests are medical wise. I know I left out a ton. This is just relevant to me. So if you also have Crohn's or if you also have anything where you need to get the tests that I mentioned done, feel free to share your experience and let me know what you think. I hope everybody has a great day and a great rest of your week. I'll be back. I will be back soon, hopefully. I want to start vlogging and doing more of these fun little videos just to do something fun and fresh and funky. I know we're talking about kind of serious stuff, but I like to joke a lot about these things because it makes it easier to cope with. We love dark humor here. So please, feel free to hang out. Feel free to recommend any kind of topics to talk about. This is all new for me, so I would like to at least talk about things that are relevant for you guys too. All right, take care, everyone. Bye.